I'm Beth Gaddis, the Vice President of Marketing at Patient Prism, and I'm joined today on set with Janet Hagerman. Janet, it is a pleasure having you here.
Thanks, Beth, for having me.
So Janet, you have 20 years of clinical experience. You have been a coach for 15 years. You've traveled all over the country delivering presentations to people, and you've written a great book called Selling Dentistry Ethically, Eloquently, and Effectively. So you've done a lot. You've been busy.
Yeah. Yes.
Well, in this segment, we wanted to talk about getting patients to say yes to dentistry. So first, can we begin by saying, why do patients say no and don't accept treatment right away?
Part of the problem is that they say no. Sometimes is that they don't say no or yes, which can be even more frustrating.
It's more like, let me think about it?
It's let me think about it. It's overwhelming. So they say no because, the standard answers are, I don't want what my insurance won't pay for,
Right.
or I just can't afford that, or it's too expensive.
Yeah.
But by handling it in a different way, we need to dig down and help our patients line up their guidelines and their values with what we're trying to do to help. They do come to us to say, what do I need? I need a checkup, check my teeth. So,
right. And they know coming in that they probably have something that they need to have done.
Yeah, particularly if they haven't been to the dentist for a while.
Right.
So this is the thing. This is the difference. In school, we are trained to be very, very clinical. We're a very technical, clinical, logical, left brain type of industry. That's all we do all day. And so when we're presenting treatment, when we're talking about treatment, we typically tell our patients what they need in clinical terms.
Right.
So
You need scaling and root planing. Doesn't that sound fun?
It's not even a real appropriate description of what we do anymore,
Right.
but the wording is rather obsolete. But at any rate, buying is an emotional decision. We buy with our emotions, and then we follow up and justify them with logic.
Right.
So how do we meet our patients where they are? How do we meet them at that emotional space and help them make those emotional decisions? So I call it this discovery process, and that's what I use is the discovery process.
So talk me through that. What does the discovery process look like?
It starts from the very, very beginning. So it starts from the front. Everybody has to be involved, first of all.
Okay. So from the very first phone call?
Absolutely.
Okay.
Absolutely. Well, as you know, in your business too, Patient Prism, it starts with that. It actually starts even before that when they're looking at their website.
Exactly.
But for our communication purposes, whenever I do a workshop or whenever I present, I spend a really good bit amount of time talking about mindset.
Yeah.
What is the mindset of the doctor? What is the mindset of everybody in the office? Because everybody has to be on the same page. So are you really committed to the dentistry that you're doing? Do you think it's worthwhile? I've heard people say things like, well, I'm sorry it's so expensive, or, tell your mother why this is so expensive, or, things that just don't support a patient wanting to make a good decision. So there are touch points all the way along the patient experience that can help promote an aura, an atmosphere, if you will, of wanting to get good dentistry.
And moving them to saying yes to that clinical treatment that they need.
Absolutely. Absolutely.
So give us a few more examples about how do we need to change our thinking if you're in one of those practices where maybe they're not wholeheartedly supporting what the clinical diagnosis is.
First of all, everybody needs to understand that you don't have to be, this is not a salesy conversation. You don't have to be a salesy oriented person. You can be a quiet, demure. As a matter of fact, some of the best salespeople are much more low key. They're more effective.
Okay.
The other thing is understanding that this is selling from the heart. We typically sell from the head.
Right.
Clinically. So we need to be selling from the heart, from the emotional side of this.
So what are some questions that you might be asking your patient and that you're not currently doing in order to...
Open-ended questions. Open-ended questions, finding out what that patient's values are. So here are my two favorite. Beth, what is the most important thing to you about your teeth? All right. So some of the answers that you might get typically fall within the category of cosmetic dentistry. I just want my teeth to look good, or I want whiter teeth, or I want them straighter. Or it might fall into the functional category. I don't really care what my teeth look like, but I want them to last. I don't want to lose my teeth like my grandparents.
You want to be able to eat again without pain.
I want to be able to eat again.
Right.
You might be a combination of both, or very extreme. I once had a patient that came in for her cleaning appointment, and she said, "Will you just clean my front teeth? I'm going on vacation and I have to go shopping and I'm in a hurry, so just clean my front teeth."
What did you say?
We cleaned all of her teeth, but she's an example of a very, very cosmetic person.
Right.
So when you're presenting treatment to patients, you can be presenting the exact same treatment for the exact same tooth in the exact same location, but to two very different people.
Right.
So if I was presenting treatment to my patient, Nancy, let's call her,
Right.
I would be saying something. I wouldn't even talk about the crown. I would be saying, "Nancy, I know you're going on vacation. You are a beautiful woman. You deserve a beautiful smile. This crown, Dr. Ben, our doctor, is amazing. That tooth is going to look just like the rest of your smile. It's going to be beautiful." I'm going to use words like beautiful.
Right.
And by the way, it's also going to be a lot more functional. It's going to be stronger. But I'm going to focus on the cosmetic because that's where she is. Now, if she wants more information clinically, she'll ask me. And then that gives me permission to go into that clinical conversation. But for the most part, these sales conversations are not clinical conversations. Right. They're emotional conversations.
So what if you're having that same conversation with a patient who is more functionality based?
Exactly. Perfect. So if that person, John, I would say, "John, I know you're concerned about the foundation. You told me that. So this is going to strengthen that tooth. This is going to make it stronger. It's just like you don't paint the house before you have a good foundation. You need to cover this with something that's going to be stronger." And by the way, Dr. Ben, our doctor, he does beautiful work. So not only will it be strong, but it's going to look great too. And I know your wife will like that. But
Okay,
the main
gotcha.
thing that you want to remember, and that I know that you're concerned about, is you told me you want to keep your teeth for life. I'm here to support you in that, and this is going to help with that. And by asking the values questions, and these values questions are important, you can use them in a lot of different places in life, but once you understand somebody's value because they told you that, then you can say, you told me this was really important to you, and I'm here to support you in that. I'm here to support your goal, and this is the way that we can do that.
And changing how you talk about dentistry to your patients, meeting them where they are, kind of understanding whether they're more functionality-based or cosmetic-based, this can have a huge impact on your bottom line and with case acceptance, right?
Absolutely. We only have 30 to 50% case acceptance average.
Currently, right now.
Currently, right now, that's across the board. That's the average. So I always tell people, find out what your case acceptance really is. Check your numbers. Because there's such an opportunity there of revenue that's left on the table and patients walking around that have been diagnosed that aren't getting the treatment done because somehow we haven't hooked up with that value or kept them in the loop, kept them in the process. Maybe we planted some seeds rather than just letting them walk out the back door.
Well, for more information, if people are trying to reach you, the best place to go is www.janethagerman.com.
Exactly.
Fantastic. Thanks so much for coming in today. I appreciate it.
As always, thanks, Beth.